Welcome to my channel once again today. And Hi everyone, welcome back to my channel. And we explore global system through the lens of equity, accessibility, innovation. So if you're new here, hit that subscribe button. Let's dive into today's topic. And today's topic is about inclusive healthcare system in the US and the UK. Excuse me. I'm sure you ask why US and UK. I'm sure there is something we are going to learn that we are going to use in our own country. So why inclusive healthcare matters? Why inclusive? Why are we talking about inclusive health matters? Why should we talk about health for person with disability? Okay? And our focus, like I said, is in US and the UK today. So healthcare isn't just about treating illness. It's about ensuring dignity, access, equity for everyone. And for people with disability, that means systems that are designed to include, not to exclude. I have right to health, I have right to live, and to have a healthy life. So today, we are comparing how two major countries, the United States and the United Kingdom, support people with disability through their healthcare system. What's working for them? What's failing? And let's break it down. So we're going to start with the United States of America. We're going to look at what is working. Americans with Disability Act. That shows that Americans have what a Disability Act called ADA. It requires healthcare providers to offer accessible facilities and their services. So if you're a person with disability, you have right towards healthcare. Then another one is Medicaid and Medicare. This agency or institute provides coverage for many persons with disability individuals, including long-term care and assistive devices. So they have the support of assistive tools, wheelchairs, standing frame, walking frame, brailler, canes, anything that can aid them is provided. Then they also what they call telehealth expansions, and this started when we had a post-COVID. So we have to start having what we call a remote consultation, have improved access for people with mobility challenges. So people started doing what? To telemedicine. With your phone, you can consult a doctor. You will talk with the doctor. You will assess you, consult with you, know what is wrong with you, and direct you on what to do. So that is really, really impressive. And I'm sure that many countries also have started emulating this, because I know they have video consultation here in Nigeria. So our focus today is in UK and in the US, and you can see how they are navigating their health system. So what needs to improve for United States? United States have a fragmented system. Healthcare varies by state, insurance provider, and income level, creating gaps in access. So they have different states is autonomous. They make their policy, they do have to set them, and also the insurance provider, meaning you must have something before you can access to what they have. Okay, and also what's level of your income. So I don't know if it means that your living income means the level of support you also get, but it's not unified. So if you're in Houston, in New York, in Nebraska, in Ohio, in Washington, the system varies, but there is a system for person with disability. So some system can be more accessible or more inclusive than the other, or more juicy in provision of what person with disability needs than the other. Then the second one is high costs. Even with insurance, out-of-pocket expenses for therapies, equipment, and specialists can be overwhelming. And they say this need to be improved. This is where this thing is so true. The therapies of person with disability or any person is high. The equipment and our assistive tools needed by person with this is also expensive. I'll tell you, to get a wheelchair suitable for me is up to $6,000. Yes, because you need to get my wheelchair that will suit my height, my level of injury. Yes, many of us using any kind of wheelchair which give us hunchback, which give us much pain. For you to get a wheelchair that suits anybody's level of disability need to what? Cost so much, and that's why they said in America that this is need to be improved. They want to look into it and ensure a better way of handling it. So the next one we want to look into is inclusive healthcare in the United Kingdom. What is working for them? What do they put in place that is actually working for them? So for United Kingdom, they have what they call National Health Service, NHS. And this institute or agency or commission offers universal healthcare, removing financial barriers for most disabled individuals. So it means that with little money or any person registered, you can be able to access what? Healthcare under NHIS. Inclusion health framework. What another one thing? Inclusion health framework works for them because it focuses on improving access, experience, and outcome for socially excluded groups. So people can call minority group, person with disability. This kind of institute takes care of their what? Health. Then we look at integrated care systems. It's also designed to coordinate services across health and social care sectors. So this is what they have that is working for them. For United Kingdom, they have the National Health Services, they have Inclusion Health Framework, and the Integrated Care System. So they say at the moment this is what works for them, and there may be other ones, but this is one we're looking into that also help person with disability. So the question is it really working? So they now have what needs to improve. As they have those things work, they still have areas they need to improve. So they have what they call service design barriers. So they say that people with disabilities often face logistical challenges like inaccessible clinics or poor communication tools. So this is the challenges they face. So people that are in rural area might find it hard to get to the clinic. The logistic, the assistive vehicle that's supposed to carry them and all that. They also have this as a challenge that are working on their representations. So they say that the person with disability voices are often missing from policy making and service plan. This is true. So that these people with disability, person with disability, they ought to come to talk. They ought to come and be part of the plan, part of the policy, but they are missing. Meaning that everybody makes decision for them, which is not accessible or acceptable for them. Okay. Then another one is stigma and discrimination. He said this is things he still need to work on in the United Kingdom, that negative attitudes among some healthcare workers say affect the quality of care. So you can see it's like all over the world there is discrimination of person with disability. And they say this is where they also need to what? Improve. So we're going to look at the common challenges in both United States and also United Kingdom. And one of their common challenges is physical accessibility. Not all facilities are wheelchair friendly or sensory inclusive. I like this honesty, not all. Even though they are very developed, they are still facing these challenges. This is telling us that person with disability is a community, is a movement that need to really look into, that the social barriers has to be removed. And it cannot be removed without us being person with disability. So I'm letting my voice, any country you want me, I'm Monica, I'm available to make the life of person with disability worth living and make it worth experiencing in a positive way for us living with person with disability. Okay, they will have communication barriers, lack of sign language interpreters, plain language materials, and alternative formats. Yes, few people can know how to communicate with sign languages. So how can you communicate with people that are hearing impaired when majority of people doesn't understand it? So it's a very big challenges, and that calls for more training for persons with disability and person without disability to learn what sign language. But look at data gaps. Persons with disability population are often invisible in health data sets, making it hard to track outcomes. Yes, it's so hard to actually get the number of persons with disability because disability are very now and then, and some people don't want to be identified as person with disability, and even the people that want to identify, maybe they're in rural area, they don't have telephone, they don't have any means of communication to the right source. My name is Monica Arinze. Continue watching. Today we are looking into United States and United Kingdom, their health system towards person with disability. So what can be done? What do you think that we can do for these states and for person with disability in this area? So to build truly inclusive healthcare system, both country they need to consult. What do you think we're looking at what to say to build inclusive healthcare system for United States and United Kingdom? They need to consult disabled communities during every stage of policy and service design. This is true. This is one of the challenges they face all over the world. They don't consult person with disability. They don't even consult the learned one or the people that can make rightful input in the community of person with disability in every stage of policy and service design. And second one, what they're supposed to do is to train healthcare professionals in disability awareness and inclusive practices. Many health workers are still ignorant of disabilities. Then we'll talk about invest in accessible infrastructure and technology. Yes, for you to show your really empathy and for you to also show accessibility for person with disability, you must invest in accessible infrastructure and technology. We have thousands of persons with disability that is in their houses because they don't have accessible tools, they don't have wheelchair, they don't have a lot of things. They can need to even come out to know what is happening. The next one is collect better data to understand and address disparities. Data is important. We can't do without data. And getting the data of person with disability and understanding it is key for you to make a good impact. So now I want to hear from you. What's your experience like? Have you experienced healthcare in the US or UK as a person with disability or as a caregiver or ally? What worked? What didn't? Let me know what worked for you and what didn't work. Drop your story in the comments. I want to hear your voice. Call to action. If you believe healthcare should be for everyone, give this video a thumbs up, share it with your network, and let's keep pushing for change. Subscribe for more videos on inclusion, accessibility, and global equity. Thanks for watching, fam, and remember, inclusive healthcare isn't luxury, it's a human right. Stay kind, stay curious, and keep advocating for systems that serve us all. My name is Monica Arinze. Thanks for watching. Bye for now and see you in my next video.